What's going on, everybody? I think we are live. We're getting live on Instagram. Let's see here. Hello to Instagram. I believe we are with you guys now. Can you guys hear me okay? Let's see. Roel, what's up, man? My brother Steve, how are you? I'm excited for the next couple weeks for you, man. We're going to have such a good time. Really pumped, actually. Really pumped. We're gonna got a podcast lined up. Hope everyone is well. If you're with me, say hello, Tom. What's going on, man? I got you sent me an email, and I want to do that. I'll shoot you an email back. But yes, if I can make that time, I will. I'm super pumped for you. Um, it one the because I'm not a provider for that, Tom. Carol, what's up? Stan, what's up? Lisa, thank you. Linda, what's up? How's everybody doing? All right, we're getting some people in here. Let's see. We got a few people on Instagram. What's up, everybody? B Smith, what's up? Coyote. Ivy, what's going on? Taco Tuesday. Taco Tuesday. Getting IVs with Ivy and JC. I love that. I love that. Cherry, what's going on? We got a bunch of familiar faces in here. Thank you guys for hanging out as always. We're going to have a wonderful show tonight. Doc is in the building. He's going to be here shortly. I'm actually going to get to be with him in person tomorrow, which I'm excited about. Happy early anniversary to the parents. We're going to get to Oak Ridge. Do we have any Oak Ridge people here? Sometimes we have some Oak Ridge people. We're going to hang out there a little bit. If you guys got the email today, you'll know that we did an episode on anxiety. What are you worried about? That's what the episode was about, getting to the root cause of anxiety. Anybody deal with any of this? Is it just me? I was listening to that and helping put together the article along with it, which you can check, guys. If you want to, one thing I encourage everybody to do each week is when we put out a Common Sense MD, there is an adjacent kind of written form so you can follow along as you listen on performancemedicine.net. But as I was listening to the one on anxiety, I was like, man, that sounds exactly like me. But we also we linked in there a couple really cool episodes we did with Zach Kramer, who does a lot of breath work coaching, which was super cool. Learning how to nose breathe and breathe through your stomach. I'm with you, Lisa. I'm with you. But the cool thing is there's so many things that we can do, and exercise helps me a ton. Carter's in here. Happy Monday. Carter, you know what? You know how to make my evening. That's so funny. You and I are the only ones who will get that, but the Happy Monday Ben is hysterical. I think that is hysterical. Happy Monday. We do have a stress formula. He talks a lot about saffron, L-theanine, the ashwagandha. They're all in our stress formula. You can find that on the website. I actually put a link in that to the article. Hopefully that helps some people. Gosh, we had such a cool Performance Weekly here. Brittany Miller, who if you're in Johnson City, you know Brittany. She's our PA over there. Has kind of our resident podiatry expert. Talked about fungal toenails. I think we had a question around this a week or two ago. It was either fungal toenails or clubbed toenails. But this was an awesome episode with Brittany. So thank you, Brittany, for doing this with us on Explain This. If anybody's ever had, fungal toenails, I have. Really cool episode in terms of things that you can do, and there's a lot of things you can do. Oh, nice. That's I'm gonna put this up because I know my parents are watching. Thursday's their anniversary too. August 8th. That's awesome. That is awesome. Happy anniversary to you and your wife, Roel. Happy 32nd. That's incredible. All right, Doc, ready to roll? What's up, man? Why can't I hear you? Can you guys hear him? Hold on. That's got to be me. Hold on. Can you guys hear him? Is that just me? Okay, we can't hear Doc, so nobody can hear Doc. Let's unmute it. Let's see where we're at. Let's get our team in there. Hold on, I'll remove you real quick. And we'll figure out what's going on. Thank you, guys. I hope that's not me. Can you guys hear me? Can y'all hear me? Rachel, what's going on? Okay. Okay, cool. I was about to say, because I've been really funny in this intro, and I would really hate if all my jokes went to waste, and you guys couldn't even hear them. We'll get Doc up and running. I hope that's not on my end. Let's see why that would be. Riley, what's up? Great to see you. Great to see you. Thank you for being here. Rachel, I hope you guys are having a wonderful evening. Who else is with us tonight? We got a couple people in here. Montana, I guess I'm gonna have to answer the questions. I guess I'm gonna have to do it. Montana knows about this. This is my plastic water when I'm trying to be not eco-friendly. What's the word for that? Anti-plastic. Frida, what's up? Anna, how are you? Great to see you. We're going to get Doc in here real shortly. I'm going to put this up. This also went out today with our nutrition coach, Lucas Schmidt. Lower-ish carb fruits, part 2. Part 1 went up yesterday. Part 1 went up last week. This is a part 2 episode. This was cool. There are fruits that are not high in carbs and high in sugars. He goes over them in these 2 episodes. So be sure to check that out. Thank you to Lucas for doing that with us. Lucas always does such a great job with the dive into diets. We appreciate you. We're going to do a take 2. All right, let's try it. Let's go for it. Why can I not hear him? I hope that's not on me. Hold on. There's my mama. Sorry, Mom. We're going to get to questions here shortly. Okay, if you guys have questions for me, I'm kidding. No questions for me. If you guys have questions for Doc, go ahead and put them in the comments. We're going to get to those very shortly. Those on Instagram, what's up? I see you. We're going to get to live questions with Dr. Rogers here shortly. Thank you, Frida. Go ahead and put those in because we don't have a ton of questions that came in throughout the week. I wonder what I did. Can you hear me? Man, I do not know what's going on. I cannot hear you. Okay. I hope that's not me. I hope I'm not doing anything wrong. Still nothing. We're trying to figure it out. I'll remove you. All right, we're taking questions as we have some technical difficulties. golly, I think we didn't do a sound check before, and we normally do. Jackie, what's going on? I see you on Instagram. What's going on? April, what's up? Great to see you guys. April, thank you for being with us today after a long day at the office. It was good to hang out with you here in North Knoxville yesterday. Vita Dad, what's up? Great to see you on Instagram. I think I'm losing people by the minute, Montana. I think I'm losing people. We'll be here shortly. What we might have to do. Thank you. You know, Mark's got the questions. Now I can do this one. The honest answer, Mark, is I don't know. It's been a minute. It's been a minute since I've had a haircut. I don't know. You guys are going to have so much fun in the comments tonight. I can already tell. Thank you, April. I see you on Instagram. I did a little gel for the night. Jack, what's going on, man? It's great to see you. Thank you for hanging out. Thank you for being with us tonight. I mean, does anybody agree with Carter? I don't know. I don't know if that'd be a good idea or not. I don't know. I think it'd be fun. Maybe. You calling me? We're going to try.
Can you hear me now?
Yes.
All right.
Yes.
We got it.
Okay.
We got it. I'm going to do here.
Okay, well, never mind. Wait
All right.
I'm putting them on mine.
I'm on a different computer.
All right. Guys, can y'all hear him okay? Tell Mom we got a little bit of an echo.
Have a little echo, but
I got
Other than that, we're good. Cool. Cool.
fine.
All right.
what if that happened to Joe Rogan? If you were Joe Rogan, you think he would have freaked out?
No, I think he would have handled it really well. I think he would have done great with it. Let's get some feedback from the crew. Are we coming through okay? Is there an echo on y'all's end? Can y'all hear him okay? I want to make sure y'all can hear what he's saying. I can hear Mom pretty well, so let's there we go. All right, let's answer some questions. Okay, cool. Thanks, guys. All right, audio's great. Tom's giving it a go. Carol's giving it a go. We're going to get started, guys. If you guys have a question for Doc, go ahead and put it in the comments. We appreciate you guys being here with us tonight. All right, let's get rocking, man. You ready?
Yeah.
Question is, could you guys please discuss the info I received with a recent methylene blue capsule order? It seems like a low dose, so we usually take 2 to 3, but we also take CoQ10 and other OTC drugs sometimes. We haven't seen a problem, but is there one we're not aware of? There was pictures with this. I can't get them on there. I forget what brand of methylene blue it was. Any thoughts on this as far as dosing with methylene blue?
Yeah, you're not in any danger at all with that. Again, if you're taking the pills, I think there's maybe 16 milligrams in one pill. Certainly, that's a low dose. The usual dose, I use the drops. I take the pills when I'm going on a trip, but the drops are 1/2 milligram per drop. So, we probably underdose it, if anything. I think the normal dose is 0.5 to 1 milligram per kilogram of weight. So say you were my size, 70 kilograms, 75 kilograms. You could take a whole lot of methylene blue. I mean, you could take way up there. So no, you're not in any danger at all. And again, does it interact with other medications? Or definitely not CoQ10 or any of those, but it is a kind of a natural MAO inhibitor. And if you read the warnings, they tell you if you're taking SSRIs or MAO inhibitors, which we hardly ever use anymore, you should be careful about serotonin syndrome, but that's just not going to happen at those low doses. Again, remember, they're using this IV to save people's lives from carbon monoxide poisoning and cyanide poisonings, and they use directly in your vein a way higher dose. They give it over about a 5-minute IV injection, but no, you're not in any danger, really. I think I tell the average person to start out with 8, 12, 16 drops, go up to 32 if you really are taking it for focus or any of the other myriad reasons that we take it. It's a natural antibiotic. It's an antifungal. It's an antiviral. It's heart protective. It's great for energy. I've had a couple people, it gave them almost too much energy. So I tell people, start out low and like 1 pill or maybe 8, 10 drops, which is really low, and then titrate up and just see how you feel.
It also seems that maybe they're concerned about, interacting with other, like a CoQ10, other supplements. Have you seen any, have you told people? Okay.
No.
All right. Wonderful question there on methylene blue. Thank you for sending that in. This is a creatine question. Do you think that creatine could potentially help with bone density? I know you're a big fan of creatine. What's your thoughts on this?
Yeah, I do think it could help with bone density because it helps with muscle, and muscle equals bone. So yeah, I think it could. It helps keep muscle hydrated. It's got a lot of great properties. It's not going to shut your kidneys down. It's not dangerous for your kidneys. Do you need to hydrate with it? Yeah, like you would any other time. But it's very safe, and I think it does help with bone density because it helps with muscle.
All right. Thank you for that question. Jackie, I see your question on Instagram. I'm going to get to that in just a second. Again, if you have questions for Doc, go ahead and put it in the comments. Let's get to, okay. So this is actually a really fun one, and hopefully some people that are with us live will have some things that are working for them. Recently, I put a mix of the Dr. Rogers Super Vitamin in with the CoQ10 and PQQ capsule. So the Dr. Rogers Super, as well as a chewable biotin. They were in this pill case separated by days in a morning/night dosage for a couple of weeks. When I went to start, and one of the capsules had actually become bloated so much that it was about to pull apart. Let's see, as we lose, I think we lost Doctor, or is that me?
That was you.
We're going to go to, that was me. Okay, sadly, I made the choice to throw those out, but I'm curious if this is normal. And if so, does that mean we should not be using these daily pill cases? So in essence, this question's around, how to store your vitamins. A lot of us, I think, if we're going out to dinner, if we're going on a weekend trip, we might not take all the bottles with us. What's your thoughts on this?
Yeah, that's a really good question. I've had that happen with any vitamin through the years. So yeah, it can happen really. And the CoQ10 with a PQQ is my energy formula. It also has taurine in it. So what's happening is you probably didn't put it in it got light to it. Most vitamins, to keep them fresh, they should not have light going in there. And certainly these vitamins don't have fillers. They don't have those preservatives and fillers. All they have is water and cellulose. Although they do last 2 years, you need to keep them in the bottles, or if you buy something that you're traveling with, have something that's shields it from any light, because cellulose is kind of like the cell wall of a plant. It's just an organic molecule. It's kind of like fruit would kind of start to turn darker. Think of it as the same way, that cellulose lining to it. It wouldn't have hurt you, but just try in the future to keep them, and I actually like them separated because especially if you're in a hot place, hot car, they can start to melt. So I would definitely keep them separate, and I would use one that blocks out light. Any vitamin could do that. And the ones we have, again, don't have a bunch of fillers in them, which is one reason I started making those vitamins. But yeah, keep them in their bottles or get a better container and kind of test them. It wouldn't hurt you. It's just kind of like eating a more ripe fruit. But I'm like you. If one of them had exploded or expanded that much, I probably wouldn't have taken it, but it wouldn't hurt you.
Yeah, it's super interesting. And I often wonder, when I take my vitamins to work and I leave them in my car, it's hot right now in East Tennessee. How long can they be out there? If there's anything that you guys have seen working, those in the comments, let us know. I see, Tom's saying just a daily pill holder. I think that's awesome. Susan saying keep the little moisture packets from the bottles and put them. Oh, that's interesting. So the moisture packets in the different slots of the pill case. That's cool. Thank you, Susan. All right.
Great point. I'm glad you asked that question.
Is there any rule of thumb you have with keeping them in your car?
I wouldn't leave anything in a car all day. A heated car. Gosh, I got in my car today. It was
like 100.
I bet it was 130 degrees in my car.
Yeah.
Until I got it cooled off.
Great question there. Thank you for sending that in. Guys, we're going to go to the live comments now. Appreciate everybody sending in questions. If I missed you, sometimes I do that. You can shoot me an email now. I kind of got my eye on it. Let me know, and I'll still ask that question anonymously. But until then, I'm going to get to the live questions here. Thank you to all who have been with us this evening. I want to get to Jackie. One, it's just so good to see Jackie. Thank you for hanging out with us tonight. Jackie on Instagram is asking, and I can't put this up, so I'm just going to have to read it out to you, Doc. How long does it take synthetic progesterone to drop out of your system? We've talked a lot about synthetic versus natural progesterone. The question is, how long does it take for synthetic progesterone to drop out of the system?
Oh, you're talking like maybe a birth control pill or medroxyprogesterone, which comes in a lot of different forms. That's it comes in shot form. It comes in Implanon, which is those rods they put in your arm for birth control. The Depo-Provera shot is a synthetic medroxyprogesterone, which we never use. The bad actor, if you hear anything bad about women's hormones, it's going to be medroxyprogesterone or maybe estrone. Those are the two bad boys. But of course, we never use those. But gosh, if it's a synthetic progesterone, if you're talking about an oral one, then I would give it a week to get out of your system. If you take a natural one, it's way less, 12 to 24 hours. And that's why, when you take a natural bioidentical progesterone, which is so good for people. I take one. I take a low dose myself of a progesterone to counterbalance estrogen levels, to kind of handle them. And also it helps you sleep at night. I take a low dose, but I also remember to take it with the mixed tocopherols, like the gamma E. Because when you take it with a natural vitamin E, it makes it last longer because you want it to last longer if it's a bioidentical. So for all those women, especially out there taking progesterone at night, take along with it the mixed tocopherols, the different forms of vitamin E that are natural, and it really enhances the absorption by about 4 times. So it's a good little trick that you can use to get more out of your progesterone, your natural progesterone. Again, we do not do synthetic.
Such a great question, Jackie. It's one we deal with every day in the office, and I hope that helps. If we need any more context, let me know. I'll be looking in the comments there, and but hopefully that helped a little bit. Ben Curtis, what's up, my brother? So good to see you. So excited for where we're heading, man. I'm so pumped you're on the team. Thank you for being with us tonight. Let's keep going. I see Jay Jenkins. Great question. We'll get to that in just a minute. Let's see where we're at here, and then we're gonna keep moving. If you all got a question for Doc, go ahead and put it in the comments. And see if I can find. Let's get to Frida. Thank you, Frida. My mom is 91 and she does have sleep apnea. Can't use a CPAP. We tried. We know she doesn't sleep good because she's on her back at night and then sleeps most of the morning. Anything else we can try to help her sleep better? Pillows, mouth guards. So this is just around sleeping better, getting more sleep at night.
Yeah, it's good to sleep on your back unless breather and can't breathe through your nose. So she may have a lot of congestion, deviated septum. The nasal anatomy may be small, too small to get air in. So she's probably a mouth breather. I used to be a mouth breather until I found out I have sleep apnea, and now I can sleep on my back. Thank goodness. I do use a CPAP, and it's hard to get used to. Very, very hard. She may not be able to get a good seal on it. I would not want to use the Inspire surgical treatment for her. A dental device could maybe help her. Some people will put a little, to force them to breathe out of their nose, they'll put a little piece of tape on their mouth, so they'll kind of keeps their mouth a little bit closed a little bit, so it gives them incentive to breathe through their nose. And use a Breathe Right strip on your nose to open up your nasal cavity. I use one of those anyway with a CPAP. And maybe, she may be one that should try sleeping on her side. But there are dental devices, there are Breathe Right strips, there are things that can kind of move the jaw forward a little bit. My conversation with Dr. Whit Moss, the sleep dentist, go look at that podcast. You might even want to make an appointment to see Dr. Moss and see if he could help. But yeah, there's a way. And again, why not, use an Oura Ring and see what kind of quality sleep she's getting. It'll keep track of the O2 sats at night, and how restless you are and breathing abnormalities. That's really that gave me the clue that I had sleep apnea. Couldn't believe it.
Yeah.
But certainly, I don't nap during the day. I don't fall asleep watching TV. I feel way more energetic. It took me a couple months to get used to that CPAP machine. But I feel a whole lot better. If you look at my Oura Ring, my nights of sleep are way better. My heart rate variability is way better, twice as good. My biological age has moved down. I'm now 8 years younger than my chronological age. So that makes me feel good, especially since I'm about to turn 70 here. So, there's ways to do it. Hopefully she'll try some of them out.
I thought with your biological age, you're gonna tell me something like, my biological age is now 31.
Well, that's the idea in my head. I'm 31.
Hey, real quick, I want to, get some feedback from you. I know you started, on your CPAP a while back, and it was an adjustment. Like, have you noticed big differences in just the way you feel? I know your numbers have improved.
Yeah, I just told you, I don't feel sleepy during the day. I don't fall asleep watching TV, watching the news, watching a ball game. I don't fall asleep anymore.
It's so interesting.
So it's great. I mean, it's just pretty amazing. I think almost every adult should really get a sleep test. And now the home sleep tests with the rings are so easy. And remember, it's not just overweight people or people with a big neck that can have sleep apnea. As you age, your I think your upper airways get a little more congested, a little more lax, and it's just the way it is. So don't hesitate to get a home sleep study. They're affordable. They're accurate. That's what I did. So
Yeah. Yeah, it's so interesting. If there's anybody in here who has had, a huge success story like that with a CPAP or any sort of sleep apnea treatment, let us know, because being able to sleep at night can change your life. It sounds like Doc is feeling way better. Okay, let's keep moving here. Thank you for that question, Frida, and teeing us up there. I'm going to move here. Let's see where we're at. So many great comments. Thank you, guys. Lisa is saying, I was having major upper and mid abdominal pain. Had an endoscopy 2 weeks ago and had a grape-sized ulcer in the abdomen. Isn't there medication that can heal ulcers? What can I do to help heal it? Well, shoot, Lisa, we hope you feel better. What's your thoughts on this for Lisa here?
yeah, a lot of it depends on what caused the ulcer. Most of the time, it's a bacteria called H. pylori. I'm sure they biopsied your abdomen and will tell you that, because it's a treatment with antibiotics. There is a more natural way to treatment if it takes weeks. If I had one that big, I would do the typical treatment, antibiotics and short-term use of PPIs, and also, maybe looking at your gut microbiome, and if you're not taking pre and probiotics and digestive enzymes, you need to start with something like Digest Shield. But that should heal. But I bet you it was a bacteria that caused it. But keep us informed. Listen to your GI docs, and also, eat a great diet and avoid non-steroidal anti-inflammatories, and you'll heal up.
Lisa, thank you so much for putting that question, that comment. I hope you start to feel better. Keep us posted as always. And Lisa always shares the broadcast. Thank you so much for that. Okay, let's keep moving here. I think I saw a question from Edna. Hello, Edna. Is it okay to take Celebrex with low-dose naltrexone?
Yeah, certainly.
Okay. Certainly.
There's no contraindication at all with that. The only thing you want to watch out for with low-dose naltrexone is opiates. So you don't want to take opiates with it. And that's why I tell people that, like, you need to stop your LDN if you're getting surgery, major surgery, where you may need some pain medication for a few days afterwards. Just stop your LDN about a week before you get major surgery as well.
All right. Thank you, Edna, for that. I see Jasmine's in here. Jasmine, what's going on?
Jasmine.
Great to see you. Our esthetician in the West Knoxville office. We're actually going to be doing a show at the Pink Bride this weekend in Knoxville. I'm excited about this. If you guys are attending the Pink Bride, we'll be there. All right, let's keep going to Velma. Velma is asking, I have a relative who is taking acidophilus. Would it be okay for her to take the Digest Shield with this?
Sure. Yeah, no doubt. The thing about Digest Shield, you're not just taking one probiotic, you're taking 11. And you've got all the other stuff, the digestive enzymes, the prebiotics, the lactase, the chitosan. It's just an all-around great GI pill. It's the best I've seen. It's all there. So probably wouldn't need to take the acidophilus. Just takes the Digest Shield.
All right, Velma, I hope that helps. Thank you so much for that question. Let's get to Jay Jenkins has been waiting. Thank you, Jay Jenkins, over on YouTube. Do you have an integrative oncologist that you refer to? It's actually a common question we get. And I'm interested what your thoughts are on this.
I wish I knew one that was, I'm looking for one right now to talk to, because I really want to do a podcast with one. I think there may be one in Knoxville or Morristown. I bet Robin Riddle would know, but
yeah.
we'll try to get an answer for you, because that's one I'd really like to hook up with.
Out of curiosity, what is an integrative oncologist? Like what, because I mean, oncologists are very traditional as, for good reason. What would an integrative, just somebody that's looking a little more deep into it,
Yeah,
more alternative?
Well, to me, it'd be one that, looks into both,
Okay.
that is not as traditional as a lot of them.
Yeah.
More integrative, meaning more focused on natural cures as well as other cures that you may have to do, whether it be surgery, chemo, or radiation, but other ways to integrate that with it, like nutrition. Nutrition is so important, and most oncologists would just say, well, eat what you want. You don't want to get too wasted away. Eat everything you can. But I don't agree with that. You're just feeding, especially if you're eating sugar, you're just feeding the cancer. Same thing with iron. But so yeah, I hope we can find one that we can really talk to. I'd like to do a podcast with them, and maybe also a integrative pediatrician would be fun to talk to as well.
I love that. Jay Jenkins, thank you for that question. And like Doc said, we're currently on this. We're trying to find one, and you'll probably get a podcast with it. Okay, let's get to Kathy. Hello, Kathy. Hope you're doing well. Hey guys, my sister is having high blood pressure problems, and the doctor just keeps adding a new pill. What could be making it stay up and not go down? The pills so far are not helping. What's your thoughts on this?
When that happens, you really need to look for the cause of it. There's a lot of underdiagnosed hyperaldosteronism. So she probably needs some further testing to check renin levels, that renin-angiotensin system that causes you to retain mineralocorticoids that keep your blood pressure balanced. Sometimes there's a renal artery blockage. So look for the source of it. Most cases of high blood pressure are familial, meaning kind of inherited, but that tendency, and it certainly gets worse as you get older because your arteries get stiffer anyway. But they need to look and do a kidney workup on her to see, if something else may be going on. And if it is, there's good treatment for it. So that's a great question, and ask to see a specialist. She may need some some functional imaging and also some mineralocorticoid renin levels and aldosterone levels done. So ask your doctor if you're not getting anywhere. Hey, I'd like to go get a second opinion from a specialist on this.
Kathy, I hope that helps. Thank you so much for putting that in there for your sister. I want to piggyback off the integrative oncology question. Jackie's asking on Instagram, iron feeds cancer. How do you, question mark, I can't put this up. Sorry, guys. So iron feeds cancer?
Can that and sugar both. Yeah.
Okay, so it can. And then that goes on to say, how do you treat anemia while undergoing cancer treatment? Currently dealing with this with my mom.
Sometimes it takes a blood transfusion. Sometimes erythropoietin is another thing that can stimulate red blood cell counts without raising your iron levels. Again, that's something. The good thing, if she has cancer, she's seen a hematologist, oncologist. They go together, so they should be able to deal with that. But ask about EPO. That's that illegal substance that bike racers use to raise their blood counts and your oxygenation when they're riding a bike. It's illegal with that, but for patients with cancer and renal disease, it can be very, very helpful.
That's interesting. That is interesting. Jackie, I hope that helps. I'm going to put this up from Katie. Katie, thank you for being here as always. Beef liver helps with low iron. That's awesome. Thank you for putting that in there for us. All right, we're going to keep moving, guys. If y'all have a question for Dr. Rogers, go ahead and put it in the comments. If I've missed anybody, maybe put it towards the end. It'll help me find it. I'm going to go to Dennis. Dennis, it's so good to see you, man.
Hey, Dennis.
What is your opinion on hydrogen water?
I use it. I bought one of the things, and it's a glass hydrogen percolator. I like it. I think it really gives me a little bit of energy. It's supposed to just deliver your ions a little better. So I drink it several times a day. It seems to give me energy, makes me pee a little more too, to be honest with you. But maybe it's just because I'm drinking more water. But if you look at Gary Brecka's stuff and some of that, it's kind of the new fad, but it kind of makes sense.
Yeah.
But I do like it, Dennis.
That's interesting. One thing I think is kind of cool to look at. I've seen you get hydrogen water ready.
I just got handed my bottle right here.
There we go. How often are you drinking it?
4 times a day.
4 times a day.
Yeah. You just push this little button. You put your filtered water in there, push a button, and you can see it kind of percolating up.
I have to ask, did
hydrogen ions.
Did Ike bring that down to you?
Yeah. Hey, actually, Ike did bring that down in his mouth. Actually, it's more like Izzy would do it. Izzy brought me a turtle inside the house the other in her mouth. Brought the turtle into the living room. Was playing with the turtle.
Yeah, I mean, I guess she just wanted to bring a turtle in, because why not?
That's the second one she's caught.
Dennis, thank you for that question, man. I hope that helps a little bit. Let's see. Let's get to Jack. No, sorry, DPC. I'm going to get to you in just 1 second. I'm going to get to Jack here. Sorry about that, DPC. Jack is asking, I wake up several times a night. I fall back to sleep fairly easy, but I can't sleep for more than a few hours at a time. Any suggestions? Man, Jack, this is super common. I'm totally with you on this one. I know you got some suggestions, Doc. What's your thoughts?
Yeah, it's very common. It happens to people that, I don't know how old you are, Jack, but when you get around my age, almost every patient complains of that. Some of them can fall asleep very well. Others wake up early, can't go back to sleep. You need a good sleep schedule for one thing, and get yourself an Oura ring.
Jack is young. Jack is 28.
Jack's 28. Man, you're young. You should be sleeping better. So I'd get a sleep study for one thing. I at least get an Oura ring. Make sure you're not getting hypopneic, low on oxygen. Look at your routine. Are you napping during the day? Are you sleeping in a cold, completely dark room without any EMFs and lights that may keep you awake? Do you snore? Are you worried about something? Are you anxious at night? I think that's a big question. Are you wearing yourself out physically? My podcast today was on anxiety, and two things which I equate really with more worry and fear. So if you're anxious over something, you might ask yourself that question. A lot of times, if you wear yourself out physically in the gym, not late at night, but during the day, you'll sleep better. But you may have a sleep disorder. I don't know. I'd be interested to see if you're how you feel during the day. If you're falling asleep while you're driving or working or reading, you might try, if it's a little bit of sleep anxiety, you might try some L-theanine. It tends to calm, that what I call circus mind, or it just turns off that worry. I'm sure you've tried melatonin. Work your dose up a little bit and see how you do on melatonin. There's an answer somewhere, but you really want to find out why. Have you always been this way? There's a few inherited disorders like that, but there's usually something pretty good that'll help you. It's just interesting. You may have ADHD. It's interesting. I put if I diagnose adult ADHD, which I treat a lot of it, when I give them a stimulant, to help their ADHD, they sleep better at night. You don't use the stimulant at night, but they take the stimulant during the day and they sleep great at night. But try to at least get an Oura ring and see. Don't nap. Do work out heavy. I'm not anxious. So it's not, you've probably done all the sleep hygiene measures already and probably tried some of the supplements. But there is not only obstructive sleep apnea, there's central sleep apnea as well. So you may have a disordered day-night cycle. I'm not sure, if you have a stressful job, if you have to work different shifts, you go to bed the same time, get up the same time, even on the weekends. There's an answer somewhere, Jack. First thing I would do is probably get an Oura ring and then maybe a sleep study, a home sleep study. And then if that's equivocal, maybe get a lab sleep study, where you have EEGs on your head and they can kind of look at your brain waves.
I'm going to put this up from Katie because this is super interesting. Magnesium spray on your feet at night will help you stay asleep. I've been trying this for about 2 weeks, has increased my deep sleep. That's so interesting. I know Katie wears an Oura ring, so I'm sure she actually has data with it increasing her deep sleep.
Magnesium is a go-to must. It looks like she's a Siamese twin in that picture. Is Katie a Siamese twin or a regular twin? Is she an identical or a Siamese twin?
That's Katie and Carter there. Huge shout out to the twins.
Their joints at the hip, that's for sure. They're really not conjoined. They're really called conjoined twins. That's not a good term. Siamese, used to use that term, but it's not. It's faux pas now. It's conjoined twins.
That's interesting. I did not know this. I didn't know the correct language around that. Do Siamese twins still happen?
You can't call them Siamese twins, Ben. You got to call them conjoined twins.
Conjoined twins. Does that still happen?
Because that's put down to the Siamese people, apparently. Yeah, sure does. Yeah, sure does.
Interesting.
That's what. Have you seen Dr. Ben Carson's separation? That was his specialty.
I have. I love that movie.
Separating conjoined brain tissue.
That's interesting.
Gifted Hands. You need to read the book.
I have.
You probably
I've read that book. I'm going to keep going here. I want to make sure we let's get to DPC. I see Jackie on Instagram. A lot of great questions coming in. Thank you guys. One thing I'll say for Jack is make sure if you're taking melatonin, make sure it's the intermittent release one that's releasing throughout the night versus right at the beginning. I forget, what's it called? IR? Is it IR?
IR, yeah.
All right. Let's see from DPC here. Past podcast, I think Doc mentioned some perfect aminos other than Body Health that he likes. Would you please share what brand that is?
Yeah, it's not really. The perfect aminos are more expensive, hard to get to. I've got one that's almost exactly the same. Katie will put that up if you have, or Jenny can bring it down. I'll show you the brand name here in a second. I'll bring it down. I'll have it brought down, and I'll show you the one that I use. It's funny because I use a little cocktail in the morning of perfect aminos, creatine, and methylene blue. I just mix it all together. It doesn't taste that great, but it really is great for you, in my opinion.
I've tried that cocktail before. I like it. I think that's cool. DPC, I hope that helps a little bit. Let's get to Wilma here. Who does vitamin C treatments for cancer? Can it be done for leukemia? I'm assuming this has to, in regards to an oncologist. What's your thoughts on this?
Yeah, we do vitamin C treatments. And again, you can't go claim to the world it cures cancer, but personally, I've seen it work pretty well. And if a person had cancer, I would, besides being on a ketogenic diet, the next thing I would do would be getting vitamin C IV treatments, along with the other stuff as well. But it's really it's better for solid tumors. It's not as good for leukemia, unfortunately. But they have really good treatments for leukemia now. That are really, really advanced treatments for leukemia now. Way more so than back in the day.
Wilma, I hope that helps a little bit. Great question, and one I know that's going to help a lot of other people. Over on Instagram, Jackie saying, are central sleep apneas normal? My son is 9 and his sleep study before a adenoidectomy. I hope I'm pronouncing that right. And it showed central sleep apneas. Is that normal for a child? So
Not
interesting.
really. No, not really. So he got his tonsils and adenoids
Oh,
out, probably to give
okay.
himself more room to breathe, but he may have had a component of central as well as obstructive. It's not unusual to see a little bit of central, but if the main component's central, then, you got to start diving in and looking for prolactin levels and MRIs and stuff like that. It doesn't usually mean a brain tumor or anything like that, but definitely needs to be looked into. And if I had the home ring that we use for sleep studies will detect central sleep apnea as well as obstructive. But if I had a major showing on that, then I'd probably go get an in-house sleep lab with a specialist to try to work that up.
Even with a child?
Yeah. Uh-huh.
Okay.
Especially if it doesn't disappear on repeated testing after the adenoidectomy.
All right, Jackie, I hope that helps a little bit. Let's keep going here. Let's see where we're at. I love this from Dave. Thank you, Dave, for this. Avoiding computer screens a couple hours before bed helps a lot. Agreed. That's in regards to getting good sleep.
And I think also playing your guitar right before you go to bed. As Dave that's what I've been trying to do. I've been trying to learn a new song today, Dave. Over the hills and far away. I bet Dave can play that one good. Although he's more of an electric. I've been leaning towards more acoustic lately. But the kind of music he plays probably wouldn't be relaxing before you go to bed. He jams out a lot more than I do.
If you jam.
Yeah. I just try to play some relaxing things, acoustic, like if I play Led Zeppelin, acoustic lead, not some of the other stuff.
I love it. Thank you, Dave, for that. But I agree. Some calming music I can see as being super helpful before bed. Allison's asking. Thank you, Allison, for being here. We love you. What can you tell me about hyperreflexia, and is it progressive?
Can be. That's where you have really too brisk of reflexes when they check your deep tendon reflexes. They really jump, and you get cogwheel rigidity with it. It just signifies that your neuromuscular system's kind of in overdrive. You can see it a lot with neurologic diseases like Parkinson's and that type of thing, and some of the other more unusual ones. And then you can get hyporeflexia too, like some of the others, myasthenia gravis, some of those, but or lumbar injuries. You can have hyper and hypo with a disc, ruptured disc, but it can be progressive, unfortunately.
All right, Allison, thank you for putting that in there. And Wilma, did we answer that, Wilma, about what are they? Let me know what that's referring to, and I'll make sure we get to that. Lots of great stuff here around getting to sleep through the night. Thank you, guys. Like I always say, keep an eye on the comments. There's so many good information in there. This is from Walking Moments. Thoughts on AKG, carnosine. I don't know what these are.
AKG. I'm not sure what AK.
Walking Moments, can you give us a little context there? I apologize.
L-carnosine's an amino acid. A lot of people use it for heart health, but AKG, I'm not sure. You may have to spell that one out for me.
Walking Moments, alpha ketoglutarate.
Oh yeah, okay. A lot of people use it as a supplement. You got to be careful with it. I'm just trying to dig out something from my head about L-carnosine is different than L-carnitine. L-carnosine is safer an L-carnitine. There's some instances where you don't want to use L-carnitine. The same thing with, glutarate is different than L-glutamine. L-glutamine is more for digestive systems and muscle and brain. Glutarate, I don't tell people to use that a whole lot. I'll probably need to do a podcast on the differences between some of these that sound the same, but so I'm not going to hazard a guess as to tell you whether or not to use that supplement or not until I do a little differentiation between some of the different glutamine, glutarate type products.
That's interesting. It sounds like we do need to do a podcast on it. Lots of buzz about on AKG in Harvard and Russian universities for longevity. That's interesting.
There's something that does to the brain. I'm just not bringing it up out of the tip of my head, but yeah, we'll look into that one.
Thank you, Walking Moments, for that. I want to make sure I missed Mark here. Let's get to Mark's question. New hybrid emergency room urgent care models are expanding, eliminating the need to decide between urgent care and ER visits. Hospitals may be incentivized to classify more cases as emergency care, which is more expensive than urgent care. Is this better for patients or hospitals? I love this question, Mark. What's your thoughts?
Yeah, one problem with just urgent cares is they beg off a lot of the stuff they should be taken care of. And one problem with emergency rooms is for the patient that is too sick to go to an urgent care and needs observation for a little bit, but maybe not hospitalization. So some of the ERs across the country are bringing in kind of an intermediate step where they have doctors that you'll be in holding rooms and they'll kind of monitor you for several hours while you're getting your workup, rather than just the ER doc seeing you and deciding, hey, let's just treat them and street them, or you need to go in the hospital. We'll get the hospitals down here. When I'm not sure what to do with you. So, yeah, I think that's going to be a big new thing. Whether it'll be, I think that will be a good thing. It may be good for patients and hospitals. I don't know, but there's certainly a need for it. Those intermediate type patients that, because it's been around here, it's been terrible. We've had patients wait 25, 26 hours on an ER gurney, trying to decide what to do with them. Hospitals are understaffed. So if you had, kind of an intermediate care center, but at the hospital, I think it'd be great. But, even if you had more advanced urgent care centers, because usually they beg stuff off. I can't believe some of the stuff they send on to the ER that they don't end up handling. It's
interesting. That is interesting. Thank you, Mark, for that question and that topic. It's one we'll probably keep talk a little bit more about. Let's get to Luann here. I am homozygous factor V Leiden and had a superficial blood clot in 2018 at 42. Take a daily aspirin per hematologist. Now I am 48 in perimenopause, and hematologist said no to transdermal estrogen 2 weeks ago. Already had an appointment with a new GN. She said I could use transdermal estrogen. I am so confused between the two. Any thoughts on this, Doc? Man, Luann, I'm feeling for you. What's your thoughts?
I think you can use it. Hematologist just doesn't know much about hormones. Again, you shouldn't take it orally. We never use estrogens orally anyway, because it has to go through your liver and be processed. Could affect your clotting factors. But transdermal doesn't do this. So I'm comfortable with it, and hopefully your GYN is too. So there's a lot of misinformation about hormones or the mode of transport and that type of thing. And the hematologist probably still thinking about the old Premarin and Prempro days. But certainly I'm fine with using it. You could also do a pellet. But don't use any oral estrogens. We don't use them anyway. So go with your GYN on this one.
Luann, thank you so much for that question. I hope that helps a little bit. Let's get, I want to put this up from Lynn K. Lynn, got mom on methylene blue 16 milligrams, not as many naps now, and she's over 90. That's awesome. That's
That
awesome.
is awesome. That is awesome. I love methylene blue.
I love it.
Very few downsides. It covers a lot of things. It's just a great product.
And this is her question. I apologize for missing this, Lynn K. Does 5-HTTP meds with serotonin mess with serotonin when taking methylene blue? I normally take it before bed, but we'll consider moving it. I hope I'm reading that right.
Yeah, if you read the literature, you'll say that they're contraindicated with each other, but I've never seen it, and I don't worry about it. If somebody's on a serotonin and they need it, then it's okay. I've never seen it interfere with it at all. As a matter of fact, I've never seen a case of serotonin syndrome in 38 years. But not that it's not out there, but I think the dosing has to be looked at. Remember, the poison's in the dose with some of those prescription medicines. So if you're overdosing on those things, then it can certainly cause a problem. But I'm okay with it as far as that goes. If you want to get off, if you don't feel like you need the serotonin reuptake inhibitor, SSRI, then taper off of it if you think you can do without it. Again, they don't work that great anyway, most of the time. They don't work much better than placebo.
And this is from, thank you, Lynn K. I hope that helps a little bit. This is from Jack. Someone recommended, along the lines of what Lynn K was saying, someone recommended 5-HTP. Is that just a supplement, or can it make you groggy the next day? And maybe someone's answered this in the comments. Any thoughts real quick for Jack here?
Yeah, it's a safe supplement. That's what it is. It's not going to make you as groggy as something like Tylenol PM or one of the antihistamine things that they recommend for sleep. Those will really make you groggy in the morning. I've tried them. 5-HTP didn't really help me. Really, the only thing that really helped me, but I do take melatonin, but I take it for, I don't think it knocks me out or anything, but I take it for the other benefits of melatonin, like anti-cancer effects, etc. But you can certainly try it. Valerian root, 5-HTP, some of those things. There's so many different apigenin. There's so many different things you could take herbal wise for sleep. Even the essential oils, you can try them. Like Katie said, magnesium.
Yeah.
I think every adult should be taking that anyway. But yeah, keep looking into it and trying different things.
I hope that helps Jack a little bit. I know that's is super frustrating. So thank you, Jack, for putting that in there. Wilma, so this is around what are some good treatments for leukemia? You mentioned vitamin C, high dose doesn't work as well for a leukemia. Anything that you might say here?
I mean, chemo.
Yeah.
Unless there's acute leukemias and there's chronic. For acute, you're going to need chemo. For chronic, maybe not. Maybe not. But that's what I would say with that.
All right, let's get this over here from Instagram. Sorry, guys, for not being able to put this up. I'm going to get this for Jackie here. Is MTHFR a cause for blood clotting disorder for life, or just a worry during pregnancy? I found out from my reproductive endo that I have 2 genes of MTHFR and need aspirin and Lovenox while pregnant. Any thoughts on this one?
Yeah, I mean, it's a lifelong condition. I have both the homozygous, meaning you have both of the mutations. You get one gene from mom, one from dad. So yeah, it's not just during pregnancy. During pregnancy is a hypercoagulable state, so you're more likely to have a problem with that during pregnancy, but it's really for the rest of your life. So you should take an aspirin the rest of your life, to prevent it, and do all the other things you can to prevent that. And again, some of it depends. If you have that, you need to start looking at your homocysteine levels and doing everything protective that you can, looking at your other inflammatory markers. That's something we do with every Cleveland heart panel that we see. but I'm glad you just had a superficial clot, not a DVT. Gosh, we saw a lot of that during COVID, a lot of blood clotting. But I'm big on taking an aspirin every day. I've been doing it since I was 40, not even knowing I had that mutation on the gene. But and I also take supplements to bring down my homocysteine level, like TMG, trimethylglycine, B6, and methylated B12 methylfolate as well. So there's a lot of stuff you can do. And again, you probably have the 677TT genetic mutation. That's the one that causes the blood clots. The 1298, not as much. But so a lot of times the particular type of mutation that you have makes a difference. So.
Thank you, Jackie, for putting that in there. I hope that helps a little bit. I'm going to put this up from Tom.
And it's common. Again, don't freak out. It's common.
Yeah. Thank you. Thank you for that. I am compound heterozygous for MTHFR and had a PE at 31. Been healthy for the last 10 years, though. Tom, thank you for putting that in there.
Right. Yeah, it's very common. Again, check your homocysteine levels and check your other inflammatory markers and do everything you can to keep inflammation out of your body.
Thank you, Tom. Thank you, Jackie, for putting that in there. Let's see here. We're gonna believe we're calling it a night. I see Tabitha's in here. Tabitha, so good to see you. Thank you for all the hard work that you're doing. We certainly appreciate you. I see. Let's see if I'm missing any. Did I miss anybody?
Do we need to get that type of perfect amino? Those amino acid things. Nobody's.
Yeah. I didn't see that. We did need to get that for. Let's see here. It was for perfect aminos for DPC. What is the?
I think it's BioTrust. I'll have it brought down just to show you a picture of what I take. Is my BioTrust perfect amino thing? Can you bring that down, please? And I'll show a picture of it because I'm a big believer in it.
Okay. Roel, thank you, guys. How do we do? Let's forget about our tech difficulties, and besides the tech difficulties,
we had some problems today. We had some real problems today.
No, this was incredible. I hope you guys got a lot out of it. We always do. We have so much fun with you guys. Thank you, Jack. Thank you for being with us tonight, man. Let's see here.
We'll do a little research. We'll do a little research on the alpha-ketoglutarate. I'm just afraid to say something until I really do the research, just off the cuff. I don't like to, advise somebody about something if I'm not pretty sure about what I'm talking about. But, here we go.
Walking moments. We're gonna do some research here on the AKG. Thank you for that.
It's Advanced Bionutritionals. Here it is.
Yeah. Okay.
Yeah.
Advanced amino powder from Advanced Bionutritionals. DPC, I hope you're still with us. I hope that helps a little bit. Gary's giving us a 10. Ivy, thank you so much. I'll make sure they see that. Lisa, thank you. Steve, my brother, thank you. Carter, thank you. Guys, y'all are the best. Tom, thank you so much. And I agree with your comment there. I love this from Tom. Be careful with the aminos. I can give you a headache and put you on the pot.
That's funny.
I love it. Dave, thank you so much, man. I agree. I'm going to put this up. The fact that you do these shows, Doc, thank you so much.
We enjoy it. Thank you.
I really appreciate you doing this. And guys, I hope this helps a little bit. As you guys know, we do this every single week, 7 to 8. I hope you'll join us next week. I see so many familiar faces that are with us each and every Tuesday. Thank you. So many people on our team here with us tonight. Thank you, guys. We love you. All our Instagram people, thank you guys for being with us. Doc, I appreciate you, man. I'm going to see you tomorrow.
Yeah, sounds good, Ben. Good
Cool.
job.
All right. See you guys.
Good night.
We will be back next week, Tuesday, 7 p.m. And I'm looking for my outro because I'm nervous about my tech difficulties. Here we go.
Don't go away.